In copper poisoning, remember that metallic copper is not poisonous, while the salts of copper such as copper sulfate, copper subacetate, copper arsenite, and copper acetoarsenite are poisonous. Copper sulfate is also known as blue vitriol, which is present in the form of large blue crystals. Copper subacetate is a bluish green powder, while we've discussed copper arsenite and copper acetoarsenite in the arsenic topic. The mechanism of action of copper poisoning is that it is a powerful inhibitor of enzymes. In acute copper poisoning, the signs and symptoms will appear within 15 to 30 minutes, and the chief actions will be on the GIT, the liver, the kidney, the CNS, respiratory, muscles, and circulation. The GIT symptoms will be the same as all the irritant poisons, although the vomitus is characteristic, which is green and blue in color, and to differentiate it from bile or bilious vomit, we should add ammonium hydroxide to it. If there is deep blue color, that means it's copper sulfate. If the color remains the same, it's bile. The stool is also liquid and brown but not bloody. The liver will show jaundice and the skin will also be jaundiced. Kidney will give inky urine, remember this point, and there is decreased amount of urine and it has albumin in it. Blood has higher levels of urea. The CNS symptoms include headache, and before death, severe convulsions and coma can precede. Respiration is difficult and depressed. Muscles show cramps. The circulation can collapse, which is indicated by cold perspirations. The fatal dose and fatal period of copper is basically CuSO4 or subacetate in 30 grams is fatal, and fatal period is about 12 to 24 hours or even delayed for a week. In treatment of acute copper poisoning, stomach wash is done with 1% potassium ferrocyanide, which reacts with copper sulfate to form insoluble cupric ferrocyanide, or albumin, which reacts to give copper albuminate, which is also insoluble. Demulcents should be given, and the antidotes include penicillamine, British anti-leucite agent, and EDTA. On post-mortem, the dead body will show jaundiced yellow skin. Greenish blue froth can be seen at the mouth and nostrils. Bluish green discoloration of gastric mucosa and stomach contents is diagnostic sign of copper sulfate poisoning. The mucosa will be inflamed, congested, and occasionally eroded in patches. The mucosa of small intestine and the stomach will show these signs. Coming to the chronic copper poisoning, it will show same symptoms as that of lead poisoning. It shows green line on the gums at the base of teeth. There will be general emaciation such as anemia, malaise, and debility. Wrist drop, foot drop, and peripheral neuritis is seen. Symptoms of Wilson's disease, which is basically an inherited disease of copper where there is excess deposition of copper in the cornea, brain, and other tissues. The symptoms of Wilson's disease can be present. Bronze diabetes, which is actually darkening of the skin and hyperglycemia due to hemochromatosis. And some sources say that hemochromatosis, that is, which is actually due to excess iron, can also occur in chronic copper poisoning. The treatment will be the same as a chronic mercury poisoning, and post-mortem will show parenchymatous injury to heart, liver, and kidneys, and also hemochromatosis, as I already mentioned. The medicolegal aspects of copper compounds are that they are used as fungicides. They are also used in medicinal doses with iron and manganese sulfate to treat arthritis and inflammation. Copper sulfate is used as an antidote in phosphorus poisoning. It can be used as a suicide agent, but it is not used in homicide because of its color and metallic taste. It has been used as a cattle poison, and children can be attracted by its bright color. Accidental poisoning can occur when it is injected in vegetables to make them look green, and also in contamination of food in improperly tinned copper vessels. That's all about copper poisoning.